Have you wondered if you can receive regional anesthesia if you have a history of abnormal blood clotting? Pay close attention to this video because it can be crucial to modify some parameters. Some coagulation disorders such as hemophilia or Bonwit disease, PR, present greater risks associated with regional anesthesia. That is why it is very important that your medical staff or your anesthesiologist knows or is familiar with your medical history. That is why we ask for your pathological history, or we do an exhaustive preoperative evaluation to see what we are facing. No, this may suddenly include blood tests to see your coagulation time bleeding, your prothrombin or thromboplastin time, to see how they are not if you are within normal values. If you are not within normal values before operating and undergoing regional anesthesia, these values must be within normal parameters. Improve your aforementioned by administering not some coagulation factors or regulating your anticoagulant drugs before surgery, or failing that, not placing you under regional anesthesia or spinal anesthesia, but opting for another type of anesthesia, either general. Why this is important? Because if we subject you to surgery with regional anesthesia and you have an uncorrected coagulation disorder, there may be side effects. For example, an epidural hematoma or spinal hematoma could be triggered, which is similar to the previous one, but within the subarachnoid space, no. And these hematomas can cause compressions in the spinal cord, which leads to neurological complications in the short and long term. Any hematoma or compression of the spinal cord can lead to permanent nerve damage, resulting in neurological problems in the long run. That is why it is very important that when you undergo surgery, these values are within normal parameters. If you want to know more about regional anesthesia and general anesthesia, I invite you to download my guide on these two treatments. You can find it at the bottom of the description of this video with the first comment. If you have any questions or suggestions, you can also leave them in the comments box. And if you like this video, like it and share it with people who need this type of information. Remember that your health is our priority,